Hi, I'm Jason Copping, MLA for Calgary Varsity and Alberta's Minister of Health. And I wanted to take a moment to talk to you about an initiative that our government is supporting. It's called Modernizing Alberta's Primary Care System, or MAPS. We know that there's many Albertans out there who have a hard time finding a family doctor or a nurse practitioner to get the care that they need in a timely manner. And we also know that if we focus on primary care, we can keep people healthier longer and actually ease the burden on our acute care system, which is incredibly challenged right now with people visiting our emergency departments. So to be able to address this, the Alberta government supports an initiative called MAPS. Now, this is a task force which includes 3 panels. The first panel is an international panel. We've invited people who have experience from around the world, who come from around the country and from different countries as well, to look at what are other countries doing well in primary care so that we can actually be able to ensure that every Albertan has access to a medical home, whether it be in Calgary, Edmonton, or rural or remote areas around the province. The second panel as part of this task force is looking at the provision of care to Indigenous peoples. Sadly, in our province, the health outcomes for Indigenous peoples are far less than average Albertans, and that's a problem, and we need to fix it. And so this second task force, again, is drawing on expertise from our First Nations people, particularly those who are providing healthcare, about how do we provide better access to care, but also culturally appropriate care so that people want to access care and we can get better outcomes. And the third panel, as part of this task force, is an Alberta panel is looking at how do we implement these ideas and have a real action plan. You know, we have a number of reports sitting on bookshelves collecting dust right now over the last 2 decades in terms of fixing our primary healthcare system. We don't need another report. What we need is an action plan. And so I've asked this committee to come up with some quick hit ideas as well as a final report. And an important part of the work that they're doing was an innovation forum that was held today here in Edmonton. And the moderator of that forum is sitting with me is Mr. Stephen Lewis. Now, Mr. Lewis is a godfather in health policy in the country, over 30 years of experience, teaches at Simon Fraser University as an adjunct professor, as well is attached to the O'Brien Institute for Health Policy at the University of Calgary. Stephen, thank you so much for being here, and thank you so much for moderating here today.
My pleasure.
You moderated over the last day and a half our innovation workshop, bringing people in from across the province. I was wondering if you can tell me, what was the key elements of the workshop, and what did you want to accomplish as part of the workshop?
This workshop set the bar pretty high for itself. People have talked about making the system better, frontline care, primary health care, people use different terms. And the purpose of this was to try to give you and your department and your government some reasonably concrete ideas to turn the vision into a reality. So it's to prepare the way for an action plan. What are we going to do to make this dream real? As you say, we've got a lot of problems. We have access problems. We have for Indigenous communities. If primary care isn't expansive, if it doesn't involve a whole lot of related services and not just doctors or nurse practitioners, the care won't be optimal for them and it will not reduce the health disparities. So this was really ambitious. So it was really to give you, Minister, some things that you can take to Treasury Board, things that you can consider in your department to say, all right, now it's time to act. What's the plan look like? And this was to give you some of the elements of that plan and ideas for elements of the plan.
Well, I've heard some snippets in terms of what's coming out of the forum already. But I was wondering if you can tell me what were the key challenges that were identified by the participants?
There were several. So I would say the top ones were, as we all know, access is a huge problem. And again, none of these are Alberta-only problems. These are national problems. And in the wake of the pandemic, the global pandemic, they're international problems. I mean, every system was put through the ringer, frankly, and its capacity was stretched and it was disorienting. But it's an opportunity because what it did, it laid bare some of the problems we've all had before the pandemic. So you want to get every Albertan who wants one a regular source of care. That's a big challenge when several 100,000 don't. Another one was we talk about team-based care. that it's not just doctors anymore. Healthcare is too complex. People have many more needs. We know there are enormous unmet mental health needs, rehabilitation needs more, and you need it to be integrated. So how do you create a real team? Again, you don't just say, we're moving to team-based care. You need a strategy for getting there. And so it's a developmental process. What has to change? Other themes were, well, do we fund and pay for services in a way that moves us in those directions? So if you have people being paid out of different envelopes, or if you have to be seen by a doctor for a team to get paid, it's an inefficient use of resources. And if people have to go to different places to access all the care they need, there's a weak link in the chain and they may not get all of that care, and it's inconvenient and it may not be timely. So those are the main themes that came up. And of course, the overarching one was, all right, how do we get people engaged around these new ideas? How do we prepare the public for thinking about this in a different way? And frankly, how do we get people who work in the system to change their minds a little bit?
So lots of challenges, and I know many Albertans out there are having difficulty finding a family doctor or a nurse practitioner, getting the care they need when they need it. But also there's conversations about solutions today. And I was wondering if you could, recognizing there is a ton of ideas put on the table, if you can talk at from a thematic level, what were the general themes in terms of how do we fix this problem?
Well, in general terms, I think there's great enthusiasm for building on some of the bases that have been built in Alberta. You do have primary care networks, so that's an advantage, an historical advantage. How do you convert them into more change agents for the next step up? So how do you organize the services? Maybe have some work to do on governance. Get the citizens involved in designing this a little bit more. It can't be inside baseball, right? You want citizens engaged. We want to hear more from them on how they want the care to deliver. There's a recognition that we need new funding and payment models. What those are, always some controversy around that, but if you want teams, if you want more expansive types of care, and you want to get people better access, more timely access, you're going to need some investments. But I think what's different this time is everyone says, don't just add money without change. You want to buy change with any kind of new resources. And also, I think they're ready to define performance a little more robustly. So instead of saying we always want to improve and we have some vague indicators, I think the system is ready to say we're prepared for targets, and those are some precise targets. We're prepared to work towards them. They should be ambitious. We're prepared to be held accountable for meaningful targets that everybody has a say in defining. And there can't be 100, or you won't have any, maybe 5 or 6, and work towards them. So I think that's real progress. And finally, I think everyone recognizes that you can't just announce something and say, we're going to team-based care. Frankly, you and your department are going to have to do some real work with the system and saying, what do we mean by that? And if you want people to be colleagues, you want to diminish those interprofessional silos, you want to make sure that everybody is using all of their skills and talents to help people, then they're going to have to learn to coexist a little bit differently. They're going to have to really self-organize into teams, to trust each other, to give up some control, but to work more collaboratively because it will be a stronger team and it will provide better care. So none of this is going to get done in 6 months, but if things go well, as an outsider, I hope you can get it done in 3 to 5 years, because 10's too many, frankly. I know it takes a long time to change healthcare, but the clock is ticking and this system is creaking along right now. I mean, it's in some trouble everywhere. So if you can lead the way in Alberta to getting it done quicker and in modeling a path, you'll not only make things better for Albertans, but you'll give other jurisdictions something to admire.
Well, and you hinted at this, but this in terms of my last question is, from your perspective, why is this so important that we actually get primary care, access to primary care and the quality of primary care right?
Well, in my view, and I've looked at this for too long, and I've seen international examples, I've worked on National Forum on Health, I've been involved in commissions, the usual routine. The reality is, if you don't have a strong primary care system that really does prevent some conditions from occurring in the first place, and then the secondary prevention, which means, as we age, people are going to get healthcare conditions. They're going to break down, but to prevent them from getting worse and from keeping people independent longer, more self-reliant, so they need fewer drugs, fewer hospitalizations. You might be able to defer or even eliminate the need to be admitted to a long-term care facility. That's, first of all, a win for quality of life, but it's also a win for sustainability. I mean, it's a more efficient use of resources. And frankly, it's where you start that transition from a sickness-oriented system to a health-oriented system. And we say that all the time, but the reality is that's where it all comes home. A strong primary care system enables you to do less downstream. So you don't have to have overburdened hospitals. You don't have to build another $1.5 billion hospital that costs $1,200, $1,500 a day to operate. And nobody wants to go into a long-term care residential facility, right? They want more robust care in the community. They want their skills maintained. There's enthusiasm for the technology to enable more independence in the community. And last but not least, by any means, the workforce will be happier. You know, we have a workforce that's really stretched. And frankly, it's not very happy. People are a bit demoralized and they feel overwhelmed. Everyone in that room today recognizes that if we get primary health care right, the working conditions will be better. People will feel more effective. They won't feel so alone in trying to deal with insurmountable problems. So it's a win-win-win.
That's great. Well, Stephen, thank you so much for coming up to Edmonton to moderate the session and provide your advice. Again, you know, this session is part of our overall MAPS initiative to fix primary health care. An interim report will be available in the next few weeks to say what are the quick hits, and then there will be a final report at the end of March. So we look forward how to transform our system, not only short term, but long term. And you're quite right there, Stephen. If we get primary care right and provide the access to care that people need, not only do we get better health outcomes, but we manage our costs and ensure that we have a sustainable system. So thanks again for taking your time to moderate, and stay tuned as the MAPS reports comes out over the coming weeks. Thank you.